Hello, and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan, and I am an associate marriage and family therapist from Southern California. I currently work in a private practice where we focus on child anxiety reduction, and I also do some work for a nonprofit cancer support organization. It really drives me crazy how much we all think about our bodies. We scrutinize and deprive and overexert and find flaws, all because of societal pressure and expectations. If you really get down to the basics and think about it, the first humans on this earth did not think about their bodies at all the way that we do today. They perceived their bodies as being solely for survival and to protect them. And at the end of the day, that is all our bodies are for. Our bodies truly are miracles. The fact that our heart, lungs, brain, skin, muscles, etc. come from a combination of eggs and sperm is wild. Our bodies do so much for us daily. They protect us from illness, they breathe for us, they pump blood. How did we get to the point where we care so much about the way our bodies look that we don't celebrate the miracles and day-to-day amazement of them? Let's talk about it. I am definitely not guilt-free from thinking of how I look. I have done specific exercises to tone my arms or get abs. I have worn push-up bras when I feel like I need to fill out a dress or shirt more. I have done my hair or makeup a certain way so I feel prettier. We are all guilty of this, and in some ways, it is okay. It's okay if we do things that make us feel good and confident about ourselves, but we do need to think about where that motivation is coming from. More often than not, it comes from the exercise industry, telling us that we need to have lean legs and washboard abs in order to feel good about ourselves and be the best version of ourselves. It comes from the clothing industry, telling us that we need to show cleavage, wear skin-tight clothes, buy things that flatter our body types, or dress for success. It comes from the makeup industry, telling us that we need makeup to enhance ourselves or cover up flaws. Don't get me wrong, there is so much good that comes from these industries, but we also need to acknowledge the subliminal messaging that we need to change ourselves in some way in order to look or feel better so that we can accept ourselves and others can accept us. No one is an exception to this influence. There are also so many differing opinions out there regarding diets, weight loss, trends. No wonder that 20 to 40% of women and 10 to 30% of men are dissatisfied with their bodies. Further along in this episode, I will give some insight on methods that I have researched, used myself, and used with clients to feel better about our bodies. I truly think that the first step is addressing the societal and cultural perceptions of bodies and health, and figuring out how much what you do with, to, or for your body is influenced by that. Side note, I do include some of my opinion in this episode, but most of this episode is based on facts from the sources linked in the episode details. The purpose of this episode is to add to the continuous conversation of why our views on bodies are the way that they are, how they have changed, and how that affects us. We have all been taught that health is based on how you look, but the health at every size, or HAEs approach, has challenged that. Messages from social media and the medical system have ingrained in our minds that skinny equals healthy. The HAEs approach, as well as scientific research, has proven that this is not true. Of course, there are exceptions to this if someone does not take care of their body. Think of it like this. Having acne does not mean that you're dirty or don't take care of your skin. And having yellow teeth does not mean that you don't brush your teeth. Both of those could happen for various reasons, and they could also indicate that you may need to step up your hygiene or that there is an underlying health issue. Body size can be the same in the sense that having a bigger or smaller body does not mean that you are unhealthy. However, depending on the circumstances surrounding, body size could be an indicator that something is off internally. Weight may be a correlating factor in some health conditions, but there isn't actually a lot of proof that a high body weight causes specific diseases that we think it does. The HAEs approach emphasizes that body size and weight is not an indicator of health and overall well-being. There have been countless heartbreaking stories of people in larger bodies who have gone to a medical professional knowing that something is wrong in their body, and the professional writes them off and attributes their complaint to their weight. Then these people later on find that they do have a major health issue that is not at all correlated to weight. Even more heartbreaking is that I've had countless child and adolescent clients who have been shamed and traumatized by medical professionals due to their body size. This issue does not just affect adults. Some key and wonderful parts of the HAEs approach are that it celebrates body diversity, challenges scientific and cultural assumptions, values body knowledge and lived experiences. It honors internal cues of hunger and appetite. It finds joy in being active and moving one's body, and honors differences in size, age, race, ethnicity, gender, disability, sexual orientation, religion, class, and any other human attributes. You can find more HAEs information from the Association for Diversity and Health link in the episode details, but some of the major HAEs principles, in addition to size inclusivity, are things like respectful care, eating for well-being, life-enhancing movement, and there's also discussion on weight stigma, body liberation, and social justice in relation to body image. So really interesting things, and please take a look at that link. A quote from Rachel Hartley, who is a HAEs-focused dietitian, says, "Working with a healthcare provider who is HAEs aligned, one can expect patient-centered care, where one is treated like a person versus a number on the scale or a lab value." She says, "Many people, especially those with marginalized identities, experience immense stigma in healthcare, which results in poor care and people not seeking care. HAEs seeks to eliminate stigma at the doctor, therapist, and dietitian office." The source where this quote is found is linked in the episode details. I also really encourage you all to take a look at Poodle Science YouTube video that I have linked in the episode details. It is a super fun and engaging way to explain the issue with weight bias, and it is great for adults as well as children. Surprising to me, and maybe you all as well, is that the HAEs approach originated in the 1960s with a push towards fat acceptance and body positivity. The size acceptance movement flourished during the 1980s and 90s and emphasized that health problems among people in larger bodies were not related to weight. The term health at every size was coined in 1998 by nutrition educators Francis Berg and Joanne Ikeda. The Association for Size Diversity and Health, or ASDA, officially trademarked the terms in 2003. Ever since, the term has been widely used by medical and mental health professionals. A significant piece of research to back up the HAEs approach is the issue with body mass index, or BMI. The BMI is a tool that is supposed to measure the amount of body fat in your body, and it is used to track health issues and weight gain in individuals and the greater population. BMI is based solely on the height and weight of a person and has been proven to be inaccurate because it does not account for racial and sex differences, bone density, muscle mass, body fat versus muscle content, and overall body composition. The BMI shows a major flaw, and it is said to not be an indicator of health, as the BMI can indicate that an Olympian is overweight based on its calculations. According to the BMI, you are of normal weight if your BMI is between 18.5 and 25, overweight if it is between 25 and 30, and anybody with a BMI of 30 or more is said to have obesity. Muscle is denser and weighs more than fat, and because athletes have increased muscle mass, their BMI could be in the overweight or obese range, although they're not overweight or obese. This could be said for anyone else that BMI is not reflective of the amount of fat in your body or overall health. It is important to note, and probably pretty well known, that the HAEs approach is controversial. Some say that the HAEs approach is problematic because it enforces the idea that health is subjective when the medical system is based on scientific data and research that allows professionals to measure health. Some say that this approach is promoting obesity and has a hand in the rising obesity rates. A research article on reframing the obesity debate says removing weight completely from the discussion of health may serve to further marginalize those individuals who want support from the health system for weight management, especially those who suffer from health consequences of obesity and are unable to make the necessary behavioral changes without additional support. Most who are skeptical of the HAEs model say that there needs to be more empirical evidence to support this theory, as there cannot be systemic changes without. So, a pretty important question that you may be thinking is, what does it even mean to be healthy? So, according to the World Health Organization, the World Health is a state of complete physical, mental, and social well being, and not simply the absence of disease or infirmary. In 1986, the WHO updated this definition to include a resource for everyday life, not the objective of living. Health is a positive concept emphasizing social and personal resources as well as physical capacities. So, mental and physical health are probably the most talked about types of health, but there is also spiritual health, emotional health, financial health, pretty much any type of health that you can think of. In terms of physical health, researchers say that physical well being involves pursuing a healthful lifestyle to decrease the risk of disease, and also involves reducing the risk of an injury or health issue, such as minimizing hazards in the workplace, using contraception when having sex, practicing effective hygiene, avoiding the use of tobacco, alcohol, or illegal drugs, and taking the recommended vaccines. So these are interesting because minimizing hazards in the workplace is variable, of course, based on the workplace, and it's subjective. Contraceptives are an individual choice. Hygiene and use of alcohol and drugs is pretty subjective as well. And taking vaccines are, unfortunately, in my opinion, not required. Similarly, the World Health Organization's definitions of health are pretty ambiguous. So, what does that mean? What is health? I am truly not completely sure, but it seems that a theme in the HAEs approach and in the WHO definition is keeping your body in a place where you are not at risk for diseases or complications. And this, of course, is measured by blood tests, cholesterol levels, blood sugar, and other tests that doctors do. The HAEs approach does not say that all of these medical procedures and tests are invalid, just that it is necessary to look at the whole person and not be biased by weight. There are many people in this world living in larger bodies who are not society's perception of health and who are, by medical standards, healthier than maybe someone who's in a smaller body. Vice versa, someone in a smaller body could have super high blood glucose levels or diabetes or a risk for heart disease. The HAEs approach emphasizes that size does not equate health. If we all, but especially medical professionals, confront and alter our weight biases, that can benefit the health of our entire population. A super confusing fad that honestly changes daily, and I think many or most of us have engaged in, are diets or diet culture. It seems that at this point, our world is at a place of thinking that diets don't work. Honestly, thank God. It's important to note that diets are not the same as eating healthy and treating your body kindly. Eating healthy and treating your body kindly is a lifestyle choice, whereas a diet is where a person restricts themselves in order to lose weight. The issue with diets are that they value a decrease in weight and body size over overall well being and health. Diets value thinness and promote that being thin is the way to love your body. Diets also demonize certain foods. I see diet culture in my work with people going through cancer. And some say that sugar and meat increases the risk for cancer or promotes cancer cell development. And others say that this is not true. Diet culture really influences every population. And I am no dietitian or nutritionist, so I would definitely love to hear from someone who has more knowledge. But it seems like the food that you put in your body is just about balance. I guess that what we should try to do is to try to eat fruits and vegetables and balance our diet in carbs and sugars and don't eat too much, everything in moderation. But eat the ice cream if you want it, because the more that you deprive yourself, the more that your body will crave it. But also don't overload yourself with ice cream. It's a balance and it's confusing and it's difficult, but definitely do not deprive or restrict yourself. Remember that your body gets hungry for a reason, and that reason is because you need the nutrients to survive. So, you do not need to believe in the HAEs approach. You are free to find flaws in it. And you do not have to live and breathe the HAEs approach in order to find acceptance of your body and engage in a size diversity perspective. What I encourage you to do is to think about your relationship to your body and how that relationship may be influenced by societal or media messages. The first thing that we can do in order to build a better relationship with our body is to listen to our body. And that is something that I think we can all do more of. As I said, our bodies are made to tell us when we are full, when we're satisfied, or when we're hungry. Listen and pay attention to what your body is telling you. You can also try to engage in body neutrality rather than body positivity. Body positivity can feel unrealistic by saying, I love my body. That can feel like it's too far away from you at this point. But it is something to strive for if you're able to. Neutrality feels more obtainable. So if a negative thought comes up, such as, my legs are so large and ugly, a body neutral reframe sounds like, my legs help me walk. I am lucky to be able to walk. Another example is if the negative thought of, I hate my stomach comes up, then a body neutral statement to counteract this is, my stomach helps me to digest food and hold on to nutrients. This may feel odd at first, but counteracting the negative thoughts with neutral ones about your body is a form of a brain hack. The more you do it, the more automatic it will become, and it trains your brain to view your body in a different way. You can also do the same for exercise. Instead of viewing exercise as a chore or a way to get skinny, view it as a great way to move your body, a way to take time for yourself, or a way to boost the happy hormones. Exercise is great because it is good for your brain health. It gets your body moving. It increases cardiovascular health, strengthens bones and muscles, reduces feelings of anxiety and depression, and so much more. Exercise is so much more than just trying to be skinny. I also want to acknowledge that it is a luxury to be able to work out and exercise and also eat fruits and veggies and seemingly healthier foods. Many people of lower socioeconomic statuses do not have access or cannot afford to do these things that benefit their bodies. And this is something that medical professionals should definitely take into account when measuring health. Lastly, treat your body kindly. Revel in all that our bodies do for us. Don't starve your body. It needs the nutrients. Don't purposely harm your body because it is part of you and your body's trying its best. Note that this insight does not apply to eating disorders and self-harm, as these are serious illnesses that need to be treated professionally. Because the HAEs approach focuses on eating for well-being, respectful care, and listening to your body, it can be very useful to be used in treatment of eating disorders. Try to treat your body in the best way possible, as it is the only one we got, and it has already guided you through so much in life. I appreciate you listening to this episode of Just Therapist Things, and hope that this episode gave you some useful information on the HAEs approach and ways of thinking about our bodies. I encourage you all to take a look at the sources that I provided in the episode details, think about your relationship to your body, and try to engage in body neutrality or some of the other tips and tricks. Thank you, and I will talk to you later.